Have you ever sat across from a doctor, looked at a lab result that says normal, and thought, then why do I feel this way? Have you ever been told, everything looks fine, it's just stress? If you have, I want you to hear something. Your symptoms are real, and there's a reason why your labs keep telling you nothing's wrong, even when your body is screaming otherwise. Hi, I'm Dr. Jeffrey Brown, an osteopathic physician, and I've been helping women restore their hormone health for over 15 years. So today, I want to talk about the one hormone problem most doctors never test for. It's called progesterone resistance. And it may be exactly why you feel the way you do. And here's the thing about a standard hormone panel. When your doctor checks your progesterone, the test measures how much hormone is floating in your blood. What it does not measure, what almost nothing on that panel measures, is whether your body is actually responding to it. Think of it like a phone call. The call goes out, the hormone's there, the ring is loud and clear, but nobody's picking up the line. The line is dead on the receiving end. That's progesterone resistance. The progesterone is present. Your cells just aren't listening. So what does that actually feel like? Because this is where women get dismissed. Your labs look fine, so you get told it's anxiety, it's perimenopause, it's just part of being a woman. But here's what progesterone resistance commonly shows up as. Number one, heavy, painful or irregular periods. Number two, anxiety and mood swings that feel like they came out of nowhere. Number three, sleep that just won't come, or sleep that breaks at 2 a.m. and then won't come back. Number four, a cycle that gets shorter, or PMS that's getting worse every single year. And here's the part I want you to hear. None of this is in your head. Your symptoms are messages, not mistakes. They're your body telling you that the number on the lab sheet and the reality in your body, they have stopped matching. So why does this happen? Because progesterone resistance doesn't come out of nowhere. It's your body adapting to something. And here are the top 3 reasons of progesterone resistance I see most often in my practice. Chronic stress is the big one. Cortisol and progesterone compete for the same receptors. So when you live in a constant state of stress, your body gets flooded with cortisol and progesterone gets pushed out of the line. Think about it this way. If your hormones are playing a game of musical chairs with the receptor sites, the music stops when cortisol is in front of the chair, and it always wins. Number 2 is blood sugar and insulin. Insulin resistance quietly drives hormone resistance because they travel together. And number 3 is chronic inflammation. Think of it like having a small fire that never fully goes out. It burns low, but it keeps your whole system on edge, and your cells stop responding the way they should. So now here's where mainstream medicine and we just part ways. If a doctor looks at your normal progesterone level and prescribes something to silence the symptom, for instance, an antidepressant for the anxiety, a sleep aid for the insomnia, what have they actually done? They've covered up the warning lights while the engine keeps struggling. The number on the panel hasn't moved, and the underlying resistance hasn't been touched. And 6 months later, you're back in the same office, feeling the same way, only now you're convinced it's really all in your head. Well, it isn't. Too often, medicine focuses on silencing the symptoms instead of asking why they're happening. My job, the osteopathic way, is to ask why. So what do you do about it? So here's where I'd start. First, address the stress, because it's the driver. Now, this is not a relax more lecture. It's the single highest leveraging thing that you can do to change your receptors. Deep breathing exercises, meditating, praying, spending time in nature. These are activities that should be done several times every single day. The second thing is stabilize your blood sugar. What you eat in the morning sets the tone for your cortisol and insulin for the rest of the day. Focus on protein and healthy fat options like eggs, Greek yogurt, or cottage cheese. Third, look at the whole picture with a clinician who treats you and not just your numbers. Because a normal lab is not a clean bill of health when your body is telling you otherwise. So here's what I want every woman watching. I want them to hear this. You are not weak, you are not dramatic, and you are not crazy. And you are definitely not your diagnosis. Your labs being normal does not mean your symptoms aren't real. Common doesn't mean normal. Now, if this resonated with you, share it with another woman who needs to hear it. And if you want to go deeper, register for my free monthly educational webinar. The link is in the description below. Remember, common doesn't mean normal. Your symptoms matter, and your body's always trying to tell you something.